Medical news from Nature Medicine. Maternal hexavalent Group B Streptococcus vaccine in non-pregnant and pregnant females, a randomized phase 1/2 trial. The investigational hexavalent Group B Streptococcus, GBS, conjugate vaccine, GBS6, was found to be safe and immunogenic in both non-pregnant and pregnant women, generating robust antibody responses that crossed the placenta and persisted in newborns during the first weeks of life, an outcome that could dramatically reduce the burden of early-onset GBS disease, a leading cause of neonatal sepsis and meningitis worldwide. GBS remains a major public health challenge, accounting for up to 1 million cases of invasive disease and roughly 150,000 infant deaths each year, particularly in low- and middle-income settings where intrapartum antibiotic prophylaxis is inconsistently applied. Although polysaccharide protein conjugate vaccines have been explored for decades, none have achieved licensure, largely because prior candidates either failed to elicit sufficiently high serotype-specific antibody levels or raised safety concerns in pregnant populations. This knowledge gap prompted a systematic evaluation of a broader, 6-serotype formulation designed to target the most prevalent capsular types, IA, IB, 2, 3, 4, and V, and to assess its performance in the unique immunologic milieu of pregnancy. The study was a randomized, double-blind, phase 1 of 2 trial conducted in 2 sequential stages. Stage 1, carried out in South Africa, enrolled healthy, non-pregnant women of childbearing age who were allocated to receive either GBS6 alone, GBS6 combined with aluminum phosphate adjuvant, LPO4, or placebo, using a dose escalation schema, 10g, 30g, and 100g of each polysaccharide. After safety review, Stage 2 recruited pregnant participants at 28 to 34 weeks gestation, randomizing them to the same vaccine formulations or placebo, with a single intramuscular injection. Immunogenicity was measured by enzyme-linked immunosorbent assay, ELISA, for serotype-specific IgG concentrations at baseline, 14 days, and 28 days post-vaccination, while placental transfer was evaluated by comparing maternal and cord blood titers at delivery. Safety monitoring included solicited local and systemic reactions for 7 days, unsolicited adverse events for 28 days, and serious adverse events, SAEs, through 6 months postpartum for mothers and 3 months for infants. Across both stages, the vaccine was well tolerated. The most common solicited reactions were mild injection site pain, reported by 38% of vaccines, and transient fatigue, 22%, with no grade 3 events recorded. Unsolicited adverse events occurred at similar frequencies in vaccine and placebo groups, and no vaccine-related SAEs were identified. Immunologically, a single dose of GBS6 induced rapid, greater than or equal to 10-fold rises in geometric mean concentrations, GMCs, for all 6 serotypes by day 14, with seroconversion rates exceeding 90% in the 30G and 100G cohorts, p less than 0.001 versus placebo. The addition of LPO4 modestly enhanced the magnitude of the response, particularly for serotypes 3 and V, where GMCs were 1.3 to 1.5-fold higher than the non-adjuvant formulation, 95. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.